and in succession to the videos what I have been taking up in general medicine. So on the tetanus and the topic of tetanus I have already taken in my previous videos. In the previous years I have already talked about that what is tetanus and what are the clinical features associated to it, what is the management of tetanus. These all topics I have taken in the previous videos of mine. So today's video will be mainly discussing with what is the difference between tetanus and tetany. So tetanus versus tetany. So in this video we'll be looking at the differences, and this becomes very important in the Viva exams or in certain professional exams also. It can be asked as a short note question, or it can be asked in the Viva VOC for the general medicine or the general surgery exams in the professional exams of MBBS and BDS as well. So students, starting with, we'll be looking at the differences. So what are the differences? So students and viewers, the words tetanus and tetany, they more or less they look very similar, and some students are very much confused that they start answering that tetanus and tetany more or less they consider it the same thing, but it is not so. Tetanus and tetany are two different conditions of the body, and it has not to be confused. They may sound similar, but still they have a distinct set of properties, distinct set of characteristic features, distinct set of their clinical appearances there. So starting with tetanus. What is tetanus? It is the hyperexcitability of the nervous system causing involuntary spasmodic painful contractions with the spasm of muscles. So in the condition of tetanus, in the condition of tetany, what do we find is the condition of tetany, it is called as, it is due to the hyperexcitability of the nervous system. So this is going to cause the involuntary spasmodic painful contraction with the spasm of muscles. So in the condition of tetany, it is actually the overstimulation of the peripheral nerves of the hands and feet. So actually the peripheral nerves, they have certain kind of uh, hyperexcitability, and that is going to cause the spasmodic painful contraction of these muscles. So whereas in the case of tetanus, what do we find is, so tetanus, it is caused by a bacteria which is called as clostridium tetany. So alright, so it exhibits in three forms. It occurs in three forms such as mild, moderate and severe, and it is a local muscle rigidity. So do remember, this is a very important striking differentiating feature. In case of tetany, it is the involuntary spasmodic painful contraction and spasm of the muscles, whereas in case of tetanus, it is associated with local muscle rigidity of the jaw. So tetanus, in the condition of tetanus, that's why it is also called as, tetanus is given another name, what is called as the locked jaw. It has been also called as locked jaw. Now, so the local spasm, local muscle rigidity is there, leading to trismus, and that there is change in the facial expression. Apart from this, there is pain of the spine of the muscles. So this has been found in the condition of tetanus. So tetany, it is hyperexcitability of the nervous system caused due to hypocalcemia, hypocalcemia. So this electrolyte balance is there in case of tetany, whereas in case of tetanus, the causative organism is Clostridium tetany, and it is causing the local muscle rigidity in the form of uh, spasm of the, so leading to trismus. So that trismus is the condition where the person is unable to open the jaw. So in tetanus, there is a condition what is called as locked jaw, because there is a local muscle rigidity present associated with tetanus. So moving on to the next important point of difference, in tetany, what do we find is that numbness and stiffness around the mouth with muscle cramping. So there is numbness and stiffness around the mouth with muscle cramping is there in condition of tetany, whereas in the condition of tetanus, since it is locked jaw, so there is difficulty in swallowing the food, there is difficulty in engulfing the food, which is called as dysphagia, and there is trismus of the jaw. So tetanus is the condition of locked jaw. So the jaw becomes locked in cases of tetanus. Now, when we look at the third important point of difference, it is caused due to low calcium level. So the condition of tetany is also called, it is due to hypocalcemia. Students and viewers, do remember the condition of tetany is, it is hypocalcemia. So it is caused due to low calcium serum level, that is 4 to 8 milligram percent. So the normal blood serum calcium level is somewhere around about 9 to 11 milligram percent. So the normal blood serum calcium level is 9 to 11 milligram percent, but in the condition of tetany, since it is caused due to hypocalcemia, this hypocalcemia is causing the involuntary spasmodic contraction of the muscles and hyperexcitability of the nervous system. So this kind of a serum or electrolyte balance is caused due to hypocalcemia, and the blood calcium level falls down to 4 to 8 milligram percent. Now, whereas in case of tetanus, no such effect is there on the serum calcium level, and no such effect is there on the serum phosphorus level as well. But in case of tetany, the serum phosphorus level is elevated. So viewers, do remember, in condition of tetanus, there is as such no change in the calcium and the phosphorus level, but in case of tetany, it is a hypocalcemic condition, it is hypocalcemia, and once the body's hypocalcemia is there, the serum phosphorus rises just to compensate that. So elevated serum phosphorus level is seen in tetany. Now, tetany is the, when we look at the causative agent, that how tetany is caused, so caused due to deficiency of calcium and magnesium. So this deficiency of calcium and magnesium, it is actually the electrolyte imbalance is there, and since this electrolyte imbalance is there, so this hypocalcemia will be there, electrolyte imbalance will be there. This is going to ultimately lead to peripheral nerves being hyper irritable. So the peripheral nerve becomes hyper irritable due to this electrolyte imbalance. So, but in the condition of tetanus, when we look at the cause, I have already said, tetany, the cause is hypocalcemia. Tetanus, the cause is the bacteria, which is called as clostridium tetany. So it is caused due to bacterial infection, that is clostridium tetany. Now we move on to the next important point of differentiation, that in the condition of tetany, what do we find is that there is loss of hair, nail, enamel defects in teeth can be seen, severe headache the patient may have, diminished vision in the condition of tetany due to hypocalcemia. These all manifestations are there. Severe headache, diminished vision, and mental retardation is present in the condition of tetany, whereas in the condition of tetanus, no such signs are present in the patient. Last but not the least, how's the condition treated? So treatment is by intravenous infusion of calcium. So students and viewers, do remember, when we look at the treatment of tetany, so since tetany, it is a condition of hypocalcemia, so the treatment of tetany is done by intravenous infusion of calcium ions. So the calcium ions are given by intravenous infusion is there, but in the condition of tetanus, since it is caused by the bacteria which is called as clostridium tetany, so it is given by, it is treated by giving the anti-tetanus serum. So anti-tetanus serum, which is ATS, so it is treated by anti-tetanus serum, which is called as ATS injection. ATS injections is given, or the tetanus toxoid injection. So students and viewers, this was a very short discussion where I tried to give you the important point of differences between tetany and tetanus. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.